Okay, so good evening to all of you. Welcome back to the Pharma Rank Booster, in which we do the complete pharmacology revision, right? Good evening to all of you. Am I audible, visible properly? Okay, so good evening to all of you. Welcome back. Am I audible, visible? Yes, I am audible to have visible bhi hoga, obviously. Hana. So, hi everyone. Give me a thumbs up, give me attendance, give me attendance, give me attendance. Whoever is present over here, give me attendance, guys. Hmm? So that we can move ahead. Huh? Chalo, chalo, come on, fast. Yes, give me attendance, give me attendance. Are you there? Are you there? Let me know. Huh? Let me know. Are you there or not? Give me a thumbs up. Give me a hi. If you are here. Chalo, come on, guys. Okay, then. Fine, no worries. Let's start with this one that we have right now. Antiarrhythmic drugs. Right? No one has replied to me. Huh? That much kind of ego you have, isn't it? कि हम तो सर का reply करेंगे नहीं. We don't reply to sir. Is it? Hmm? Is it so, guys? Chalo, come on, no worries. So let's start with this one, antiarrhythmic drugs. So arrhythmia, you know, yeah, arrhythmia, you know. What is arrhythmia? What is arrhythmia? Can anybody tell me what is arrhythmia? चलो इसका तो जवाब दे दो यार. At least reply to this one. What is arrhythmia? Anybody knows? What is arrhythmia? You have read about it all over the time of your coursework, right? So what is arrhythmia? That's what I'm asking over here. Yep. What is arrhythmia? What's arrhythmia? What's arrhythmia? Mm-hmm. Anybody knows anything about that one? Anybody knows anything about this one? Yeah? No? Come on, guys. Vaibhav Dwivedi. Okay, Vaibhav Dwivedi comes. Irregular heart rhythm. Okay. Irregular heart rhythm. So it can be upwards or it can be downwards, right? So, yes. So it can be bradyarrhythmia or it can be tachyarrhythmia, right? So particularly what happens when we exercise a lot, है ना? When we stress a lot, right? So sometimes what happens, conduction of heart really goes faster, right? And that is subjected to the things towards the irregular heart rhythm, as the Vaibhav says, right? So it leads to your arrhythmia, right? So anybody else want to say something? Anybody else want to say something about arrhythmia, or which drugs we give? Huh? What do you know something about? Tell me something about arrhythmia, so that we can at least build up a base over there. Hmm? What are the drugs that we use over here? Hmm? What kind of a thing that we used to have to check the graphs? Huh? Which kind of instrument do we use over there? Hmm? Anyone? Only Vaibhav knows? Only Vaibhav Trivedi knows? Hmm? Right? No one wants to interact. है ना? Everyone is boring, it seems, right? Everyone is boring. Apart from Vaibhav, everyone is boring, right? Chalo, fine. Keep the boringness with you guys, है ना? We will be going ahead now. Chalo. So arrhythmia is what? Arrhythmia is, you can say, like the irregular heart beat or heart rhythm, as the Weber says, है ना? So what happens कि sometimes you exercise a lot, है ना? You feel somewhat kind of the emotional kind of a thing, right? So depression you had, anxiety you had, है ना? कभी कभी चक्कर आ गए, कभी कभी you feel drowsiness, so it goes around bradyarrhythmia. right? है ना? अभी you have got some adrenaline in your veins, right? And you have got rushed into things, so your heart rate goes faster, right? So that's your arrhythmia. Okay, now, and these arrhythmia are varies, right? So it depends on the number of heartbeats that occur in a particular minute, right? So it goes around atrial fibrillation, atrial, yeah, these kinds of things. Atrial fibrillation ho gaya, and your tachycardia and your ventricular tachycardia, right? Flutter, right? Those kinds of things happens in your arrhythmia, right? Now, if this one we see phases of cardiac arrhythmia, that's your phase 4, phase 0, phase 1, phase 2, phase 3, and phase 4. Yeah, phase 4 is your what? Phase 4 is your RMP, right? What is the full form of RMP, guys? What is the full form of RMP? Anybody knows? What is the full form of RMP? Hmm? And what is the actual RMP of cardiac muscle? What is the actual RMP of cardiac muscle का कितना होता है? Cardiac muscle का RMP is how much? Is how much? Yes, that's what I'm asking. That's what I'm asking. What is the resting membrane potential of cardiac muscle? Hmm? What is the resting membrane potential of cardiac muscle? How much? Guys, they do ask this one in examination, right? That's what I'm asking. Hey, it's a revision class. That's why I'm asking, no? Otherwise, I would be teaching all the way, without losing any momentum and just going all the way. That's why I'm asking. Tell me. Fine, hey, it's fine, fine. RMP is nothing but minus 90 millivolt, right? That's your resting membrane potential. Resting membrane potential is your minus 70 Navneethan. 70. Cardiac. Sure, sure. Or I am wrong. Is it minus 90 or minus 70? Vaibhav, can you tell me? Minus 70 or minus 90? Hmm? Good evening, Shravani. Welcome back. Is it minus 70 or minus 90, guys? That's minus 70. Samima says minus 70. Acha. Okay, that's minus 70. That's right. That's right. I'm wrong over here. Anna, that's minus 70 to be precise. So sorry. I apologize. Right? So that's your minus. Shravani. Here you go. Minus 70 is your cardiac muscles का RMP होता है, whereas minus 90 is your nerve muscle का होता है, right? Nerve muscles. Nerve muscle का RMP, that's your minus 90 millivolt, right? Right? Phase 0, there is a rapid depolarization takes place. Rapid depolarization, here you go. Rapid depolarization. Depolarization is what, guys? Depolarization is a influx of the sodium, right? Influx of sodium in the cell membrane, right? Into the cell membrane, right? So that's your rapid depolarization. बहुत अच्छे से होगा. That's your rapid depolarization. So that's your sodium will be sodium channel will be open and sodium rush will be taking place in, and that's going to be your depolarization will place, right? And it up to goes into plus 20 millivolt over here. Plus 20 millivolt तक ये ऊपर जाएगा. That's going to be lift up to plus 20 millivolt, right? Limited depolarization takes place phase 1. Phase 1 limited depolarization, inactivation of fast sodium ion. यहाँ पे the sodium ion channel which was opening into the phase 0, now here it will be closed, right? Here it will be closed, and now at phase 1 it will be going downwards. It will be going downwards. And what is responsible for downwards? Obviously that is going to be a repolarization, right? Repolarization will take place, and repolarization is happen with potassium efflux, potassium efflux, or you can say chloride influx, right? Chloride influx, potassium efflux, that leads to the repolarization, and they impart some kind of the negativity, right? So that's why it will not lifting upwards in direction, right? But it still goes into lower direction after the phase 1, right? And this is your phase 2. Phase 2 is also known as your plateau stage. Phase 2 is also known as your plateau stage, where calcium is less permeable to your sodium. Calcium influx through and calcium channels, right? Calcium influx through slow calcium channel, potassium channel begins to leave the cell. Here maintenance takes place, right? Jitna potassium is leaving, utna calcium are coming, right? So that's your plateau stage, all right? That's your phase 2. And after that, in phase 3, what happens? Rapid repolarization takes place after that. Rapid repolarization, again, everything is blocked, just potassium channel opens in order to reduce down until RMP arrives, or until RMP arrives, right? Okay, so phase 3, rapid repolarization, sodium gate closed, potassium efflux started, inactivation of slow calcium channel, sub khatam. Now only potassium efflux will be taking place, right? And phase 4, again, resting membrane potential, high potassium efflux and calcium influx will be taking place, right? So whatever the phases are over here, that is being described over here. See, like phase 0, that's your rapid depolarization, where sodium channel opens and that allows the influx of sodium ions. That's right. Now phase 1, period of early fast repolarization. Early fast repolarization, that's your phase 1, right? And occurs due to the stoppage of inward flow of sodium and start of potassium and chloride outflow from the cell. Phase 2, that's your plateau phase. That's your plateau phase. During this phase, calcium enters and potassium moves out. What happens in this one? So there is a balance over there, right? What I have told you, plateau phase is a balanced phase in which potassium moves out and calcium comes in a same amount, right? That's why. And that this leads to the contraction. This leads to contraction. Phase 3, going downwards, that's the second phase of rapid repolarization. Rapid repolarization takes place. Occurs, phase of repolarization occurs due to the fast outflow of potassium ions, right? Phase 4, spontaneous depolarization, again. The membrane potential resting value and fully repolarized stage occur, right? That's what happen in your all these phases: phase 0, phase 1, phase 2, phase 3, and phase 4. Now, classification, if we talk about here, classification is your class 1. Class 1, membrane stabilizing agent, membrane stabilizing agents, right? Class 1A, 1B, and 1C. 1A, 1B, 1C, right? 1A, quinidine, procainamide, and disulfiramide. This can be learned through question, reduce difficulty, right? Difficulty. If you remember, yeah, question produce difficulty, quinidine, procainamide, and diisopridine, and these are the ones which causes the Torsades the point. Torsades the point, right? Torsades the point they may cause. Why? Because they inhibiting the potassium channel. Potassium channel blockers are they? They are. That's why, right? What is Torsades the point, guys? What is Torsades the point? What is Torsades the point? Anyone? Can anyone tell me? Can anyone tell me? What is 𝘖𝙎 point? Okay, Ishwar came with the answer. That's your QT prolongation. Very right. So quinidine, procainamide, and diisopyramide can cause the potassium channel blocker, and that's why they cause 𝘖𝙎 point. Whereas mexiletine, lidocaine, phenytoin, medical lab, pharmacist. Medical lab pharmacist, right? Mexiletine, lidocaine, and phenytoin. This has been your membrane stabilizing agent 1B. Flecainide, morcizine, and propafenone. That's your 1C, right? Class 2 beta blockers. Class 2 A, and it's your B, right? Beta blocker class 2. Propanolol, esmolol, and sotalol, right? These are beta blocker as well, right? See this one. Sotalol is here and it is also over here as well, right? Because these are your potassium channel blocker. Potassium channel blocker, right? Potassium channel blocker. Amiodarone, sotalol, and bretylium, dofetilide, and ibutylide. Sotalol can be placed in your beta blocker as well as the potassium channel blocker. Why? Because sotalol is having extra potassium channel blocking activity, if you remember, right? Amiodarone is the one which is known to be as the Rajnikant, right? Which is known to be as the Rajnikant. That's your all-rounder drug, right? That's your all-rounder drug. It can be act all the way of mechanism of action, right? Now, class 4, calcium channel blockers, verapamil and diltiazem. Verapamil and diltiazem are being known to be as the calcium channel blocker, right? Drugs for PSVT, para supraventricular tachycardia, right? Paroxysmal supraventricular tachycardia. And what is the drug of choice? Toconide also belongs to 1B. Okay, sir. Thank you so much. Fantastic facts. Okay. Now this one. PSVT, paroxysmal supraventricular tachycardia. What is the drug of choice? What is the drug? What is the drug of choice for PSVT? Sir, I have studied all these chapters at least two times, but finally I'm not able to remember all these chapters. What should I do? Don't worry. AK-47 Akshay Kumar ho yaar tum. है ना? You are Akshay Kumar. AK-47. Then there is nothing to be worry about this one. है ना? This happens to that person only who read a lot, right? So don't worry. And this don't even happen to that person who don't even study, right? So you should be privileged. You should be privileged that you are having this kind of feeling, right? You should be privileged. You should be proud of yourself if you are feeling that kind of feeling. And ultimately, whenever you see the question in GPAT examination, your आंखें, your eyes will be mydriatic, है ना? आंखें चौड़ी हो जाएंगी तुम्हारी कि ये क्वेश्चन, अरे ये क्वेश्चन तो मैं ऐसे सॉल्व करूंगा, right? This question I will be solving this much in this way. So don't worry, you are privileged that you are able to feel like this one, right? As to those person who didn't even study, they don't even fear, right? They will just like, okay, okay, पासा फेंकेंगे, जय माता दी, टिक किया, खत्म, right? So that's all I want to say for your words. Okay, now tell me the answer, guys. Drug of choice for PSVT. Drug of choice for PSVT. Drug of choice for PSVT. Purine nucleotide, adenosine or digoxin. इसमें से ही होगा obviously. What is the drug of choice PSVT? It has been asked before. AK-47, I hope I have delivered your answer, whatever you wanted to ask. Adenosine. Very good, Shravani. That's your adenosine is the drug of choice for PSVT, and that's an important one. Okay. Chalo. Now, here you have the question. Queen proclaims disopyramide 1A. What is PSVT? Paroxysmal supraventricular tachycardia. Paroxysmal supraventricular tachycardia. Fantastic facts. पूरे हार्ट में तुम्हारे टैकीकार्डिया कंडक्शन takes place, right? Conduction takes place, and excessive conduction leads towards the tachycardia, fibrillation, flutter, right? And here why the adenosine belongs to the drug of choice category, right? My pleasure, AK-47. Be like an Akshay Kumar, guys. Be like an Akshay Kumar. Don't be having any kind of fear, right? Now, antiarrhythmic class 1, Queen proclaims disopyramide. Okay, question produce difficulty, whatever the trick you wanna add, just add to it. Antiarrhythmic class 3, that's your SAD. Sotalol, amiodarone, dofetilide. Preferably I buy Lido Mexican toffee. Okay. Phenytoin, lidocaine, mexiletine, tokenide. Tokenide. Here was you asking, right? Who was there? Fantastic fact, right? Tokenide. Tokenide to be precise. Antiarrhythmic class 1C, more fries, please. Morisizine, flecainide, and propafenone. Okay. Now class 1. These are your particularly sodium channel blockers, right? These are particularly your sodium channel blockers. That's acting on your phase 0, right? These are acting on your phase 0, right? In which rapid depolarization depolarization takes place, right? Okay. The class 1. The class 1 drug binds easily to the activated or inactivated state of sodium channel but poorly to the resting state, right? So class 1A question produce difficulty. Block the sodium channel in open state, block the cardiac potassium channel. Here you go. Here you go. Block the potassium channel as well. And that's why, because said the point. What I said, guys? What I said to you? They can precipitate the Torsade point, prolong the QT prolongation, just because they also block the cardiac potassium channel. Right? Now, these drugs moderately depress the phase 0 depolarization, thus delaying repolarization, resulting in prolonged action potential duration. Right? Prolonged action potential duration can precipitate the Torsade point, prolonged QT interval. Class 1B, block the sodium channel in inactivated state. Inactivated state में उसी में भी ये sodium channel को block कर देंगे. Mexiletine, lidocaine and phenytoin, they doesn't have any potassium channel blocking property also, but they have possessing potassium channel opening property. They don't have blocking property. They have potassium channel opening property, right? Chalo. These agents shorten the APD and reduces the refractoriness because of the opening of potassium channel. Drugs that have minimum effect on phase 0 depolarization, shortening or repolarization and action potential duration. Thus, these drugs use only for the ventricular arrhythmias, right? Now, class 1C. Class 1C, flecainide, morisizine and propafenone. These agents have the post-potent sodium channel blocking. Post-potent sodium channel effect with negligible action on potassium channel. Therefore, no effect on the ADP. Drugs that markedly depress phase 0 depolarization. No effect on repolarization and action potential duration. That's your ADP. Okay. Chalo. Class 2. Class 2 is your beta blockers. So beta blockers obviously going on to your beta receptor, right? Beta receptor, these drugs having antiarrhythmic property by virtue of their beta receptor blocking action and direct membrane stabilizing action and decrease the sympathetic of the heart. These drugs decreases the slope of phase 4 depolarization. Phase 4 depolarization automaticity in SA node. That's an important statement. Okay. SA node को वो conductivity को कम कर देते हैं, automaticity कम हो जाती है, right? Sotalol has both class 2 and class 3rd antiarrhythmic action. That's a very important statement. Okay, they can ask, right? They can ask. Antiarrhythmic drugs, potassium blocker. Potassium blocker, again, it can cause Torsade points and potassium prolonged QT interval. That's your Torsade points, right? So whatever the drug which closing the potassium channel, whichever is the drug which blocking the potassium channel will ultimately do the Torsade point and prolong the QT interval, right? Amiodarone, sotalol, beryllium, dofetilide, and ibutylide. Predominantly, action is to block the potassium channels, prolongation of the repolarization, and action potential duration. Torsades point and prolong the QT interval, right? Now, here it goes. Action of class 3rd antiarrhythmic agents. What happens over there? Phase 0 is thoda sa phase 0 थोड़ा सा shift and repolarization. See, action potential duration also shift है ना. What was the duration of action was here है ना. It should be around 0.8 second, right? That's your cardiac cycle है ना. That's your cardiac cycle, 0.8 second, isn't it, guys? Am I right or wrong? Am I right or wrong? Cardiac cycle is 0.8 second or not? Cardiac cycle is 0.8 seconds. Is it or not? Hmm? Is it or not? Yes? Fine. Now, calcium channel blocker. These drug blocks the L-type voltage gated calcium channel, right? L-type, you know, that's your present in your heart. Where T-type, where T-type calcium channel is present, guys? T-type calcium channel. Where the T-type calcium channel present? Hmm? Hmm. T-type calcium channel is present in. Chalo, come on, guys. Tell me fast. Ah, come on. Tell me. You are a bright student. You are very knowledgeable. You are very intelligent. Come on. Anna. Chalo, come on, guys. You should be knowing this one now. T-type calcium channel. T-type calcium channel inhibitor. T-type calcium channel inhibitor. Hmm? T-type calcium channel inhibitor. Yes or no? No. Nobody know. Nobody knows. Seriously, nobody knows. On यार, that's a science string है ना. न्यूरॉन्स में पाया जाता है टी टाइम कैल्शियम चैनल ब्लॉकर. दैट्स योर ईथोसक्सीमाइड. ईथोसक्सीमाइड. वेरापामिल. वाह 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 वाह. वेरी नाइस. वेरी नाइस. कुडोस टू. सीआरटी. सीआरटी क्या है? व्हाट इज सीआरटी? वेरापामिल कहाँ से आ गया इसमें टी टाइप में? न्यूरॉन में प्रेजेंट होता है. दैट्स राइट. व्हाट इज फ्लुओविटिन, गाइस? फ्लुओविटिन श्रावणी. नाउ यू डिलीट इट. कौन सी ड्रग है भाई ये? हाँ, विच ड्रग इट इज? आई डिडंट इवन heard about that drug. चलो. Antiarrhythmic. They block the L-type voltage-gated calcium channel. They decrease the rate of phase 4 depolarization and SA and AV nodes. These drugs mainly act on SA node as well as the AV node, right? And decrease the automaticity of SA node and conduction through AV node, right? Now let's talk about the individual drugs. If I go with the individual drugs, okay, so quinidine, that's your dextroisomer of the antimalarial drug alkaloid quinine, right? That was used in your antimalarial drugs, right? Blocks the sodium channels, right? Decrease the automaticity, excitability, rate of phase 0 depolarization. Yeah, that's right. Hana? It also blocks the potassium channel, that's why prolong the repolarization and can cause the QT interval over there. Simple, right? Procainamide, procainamide, it is orally active amide derivative of the local anesthetic. If you remember, है ना. amide derivative double I single I, तो ester double I तो amide, right? And acetyl procainamide, just because of this one acetylation say they get metabolized. Ship, if you remember, ship drug है ना. Sulfonamides, hydralazine, isoniazid and procainamide, these four things are being acetylated, right? Now, it has no sodium channel blocking property, but blocks the potassium channel and hence prolong the repolarization, right? Now, adverse effect, again. So, whatever the drug goes into the acetylation, it can cause systemic lupus erythematosus, right? SLE-like syndrome, flushing, hypotension, and rapid IV injection. Gastrointestinal tolerance can also be take place over there, right? Significance between procainamide and quinidine, that is same, that procainamide is less effective in suppressing ectopic automatically than the quinidine, right? So this is all not that important. Chalo, now this one, amiodarone, yeah, that one is important drug, right? So prolong the action potential duration as well as the QT interval, right? Just because it delay the rectifier potassium channel, it blocks the potassium channel blocker, right? It blocks the potassium channel, right? Preferentially inactivated sodium channel and inhibit the myocardial calcium channel. Has non-competitive beta adrenergic blocker property. That's what I am saying. Amiodarone is your Rajnikant, right? Amiodarone is your what? Rajnikant drug, right? And it is a all-rounder drug, you can say in English, right? It is an all-rounder drug acting on everything. Sodium channel inhibition, calcium channel inhibition, beta blocker channel inhibition, right? Hmm? Now, if I talk about this one, amiodarone is the Rajnikant of antiarrhythmic drug, right? But if I talk about the Rajnikant, or you can say all-rounder of anti-epileptic drug, then anti-epileptic drug, then which one is it? All-rounder of anti-epileptic drug, then which one is it? Hmm. Sodium valproate, right? Ishwarya, that's your right. Ishwarya, okay. Ishwarya, sodium valproate. Yeah, that's right. Adverse drug reaction. The periphery of my lung, liver, cornea is photosensitive. This is the trick. The periphery of my lung, liver, cornea is photosensitive, right? Valproic acid, fantastic, man. That's right, right? So thyroid, both hypo and hyperthyroidism it can produce. Peripheral neuropathy, myocardial depression, lung fibrosis, liver toxicity, corneal micro deposits over there. Photosensitivity, obviously. Okay, so that's a trick. The periphery of my lungs, liver, cornea is photosensitive, right? But can anyone tell me which drug is used to prevent the peripheral neuropathy? Hmm? Peripheral neuropathy को prevent कैसे कर सकते हैं? How do we prevent the peripheral neuropathy? Anyone? Which drug is useful for decreasing the peripheral neuropathy? Hmm. Anybody? Anyone? Anyone? Peripheral neuropathy, guys. Very good, Shravani. Very good. Very good. That's your vitamin B6, also known as your pyridoxine. Very good, Shravani. बहुत बढ़िया. Right? Now, let's talk about the interactions now. Amiodarone can increase digoxin and warfarin level, reducing their renal secretion. Yeah, just by inhibiting the tubular secretion. Right? Now, additive thiamine. No, Samima. Additive AV block and can occur in patient receiving beta blocker or calcium channel blockers, right? Chalo. Now, drug of choice. Now, this is important. This is very, very important round again. Okay, so atrial fibrillation, cardioversion, and esmolol. Esmolol is your shortest acting beta blocker. Shortest acting beta blocker, right? Esmolol. PSVT, adenosine. Atrial flutter, cardioversion and esmolol. Ventricular tachycardia, lignocaine. Digitalis induced, lignocaine. Wolf Parkinson White syndrome, cardioversion. Okay, now drug interactions. एट्रियल फिब्रिलेशन में, अरे ये तो सेम चीज है, ड्रग इंटरेक्शन तो लिखे ही नहीं इन्होंने, खैर लेट इट बी. ओके, नाउ ओके, तो दिस इज द सेम थिंग अगेन, राइट? चलो, now here's the first question, guys. Class third antiarrhythmic agents are, now, before starting these questions, do mark that how many questions you got right and how many questions you got wrong. Okay, and at the end I will ask that how many questions you got right and how many questions you got wrong, and then I will rank the numbers. Okay, rank the people over here, 13% over here. Do tell me how many questions you got right, how many questions you got wrong. Okay, now this one, class 1 third antiarrhythmic agents are, class third, sorry, not one third, third antiarrhythmic agents: sodium channel blockers, potassium channel blockers, sodium channel openers or potassium channel openers. Which one is it? पहले वाले सोडियम चैनल होते हैं, दूसरे वाले को बीटा ब्लॉकर कहते हैं, तीसरे वाले को पोटेशियम चैनल ब्लॉकर कहते हैं. वेरी गुड, वेरी गुड, वेरी गुड मगेश, दैट्स राइट. नवनीतन, वेरी गुड. ईश्वर आर्या, श्रावणी, वेरी नाइस, वेरी नाइस. चलो चलो चलो, दिस वन. mechanism of lidocaine action is beta blocker, renin inhibitor, sodium channel blocker, calcium channel blocker. चलो, एक तो बच्चा बच्चा जानता है, बच्चा बच्चा knows this one. हाँ, don't wrong here, don't get yourself wrong over here. Which one? बच्चा बच्चा knows. चलो, come on fast. Which one is it? Magesh, lidocaine is a beta blocker. Shravani, lidocaine is a beta blocker. Seriously? That's your C, guys, है ना? Sodium channel blocker, obviously. Lidocaine, local anesthetic, तो sodium channel blocker, right? Don't do this kind of the, blunder mistakes over there, right? Chalo, class third antiarrhythmic drugs act by. This is the third question, I think so. Yes, third question. Okay, class third antiarrhythmic. So no, sir, it's so PM channel blocker. अब तो why did you send that one ki it's a beta blocker, Shravani? कभी कभी कुछ you say, कभी कुछ you say. Now, class third antiarrhythmic drugs act by slow depolarization anesthesia, calcium entry inhibition, or adrenergic agonism. Which one is it? Class third. Abhi we have talked about in class third. Abhi we have talked about in class third, right? Abhi we had talked about. It's a slow depolarization, right? Okay. Now, which of the following is a class 1A anti-arrhythmic drugs? Class 1A. Class 1A, the 1 is automatically sodium channel blocker, right? So, which one is it? Sotalol, diisopramide, verapamil, or propanolol? Which one? Chalo, come on fast. That's your diisopyramide. Fantastic fats, very good. Ishwari Jadhav, Shravani, very good. Ishwar Arya, Samima, very good. Navneethan, very nice. So this one. Among the following, drugs, which one belongs to class third potassium channel blocking antiarrhythmic agents? Okay. Diltiazem, verapamil, amiodarone, or propranolol. Very simple. Very, very simple. Very, very simple. Question produce difficulty. That's your Amiro. Theron, fantastic fact. Very good, Shravani. Very good. That's your amiodarone, right? So the drug which suppresses ventricular tachycardia due to digitalis toxicity. That's a drug of choice question. That's a drug of choice question. D O and we have got C, right? Drug of choice. So disopramide, lidocaine, propafenone, or propanolol. Which one is it? Pharma knowledge, Vishwanta, Naveen, Than, Shankar. Shravani says B. Simima says C. Ishwari Jadhav says B. Uh, Fantastics. No, it's not A. It's B over there, guys. Lidocaine, ventricular tachycardia. Okay, chalo. Drug of choice in supraventricular arrhythmia. Supraventricular. Synconidine, procainamide, verapamil or amiodarone. Supraventricular. Ventricular tachycardia, and there is a supraventricular tachycardia. Synconidine, procainamide, verapamil, amiodarone. Which one? Which one? Some people came and some people go. That's a part of your life, and that's a part of this live session as well. Right? Okay. Supraventricular arrhythmia. That's a verapamil, guys. Calcium channel blocker. Verapamil has been used over there. Okay. Chalo. Which of the following is an antiarrhythmic drug that is calcium channel blocker? Lidocaine, nitroglycerin, nifedipine, or diltiazem? Simple. Very simple. Hmm. Very simple. मामा अर्थ का ऐड आ गया. मामा अर्थ ऐड केम. Okay. This one. Which of the following is an antiarrhythmic drug that is calcium channel blocker? That's your nifedipine, right? Sorry. Ah, antiarrhythmic drug that is a calcium channel blocker. Yeah. That's right. That's right. Nifedipine doesn't being used over here, right? If you see nifedipine, no, that's a wrong answer because it can cause the reflex tachycardia. If you remember reflex tachycardia, it can cause, right? No. You won't answer C. You won't answer C over here. D is your correct answer. Diltiazem as well as verapamil. These are being useful. These are being useful, but nifedipine cannot be used in your anti-arrhythmic drug because they can cause the reflex tachycardia. It can worsen the things, right? Nifedipine. That's why. Chalo. The mechanism of action of propafenone. Alpha blocker, block potassium channel, block sodium channel, or block calcium channel. Dihydropyridines and non-dihydropyridines, sir. Yes, that's right. And a non-dihydropyridine में भी particularly what that was. What that was. Do you remember what that was? If I talk about benzothiazepines, benzothiazepines. That's your diltiazem, right? Diltiazem. And if I talk about this one, verapamil, that's a phenylalkylamine. Phenylalkylamine. That's your verapamil. Okay, that's your verapamil. So बहन जी का दिल, right? बहन जी का दिल, or you can say बाबर आजम, right? Okay, phenylalkylamine PAM. Okay, PAM, phenylalkylamine. So this is the trick to remember the category. All right. Now, mechanism of action of the propafenone. That's your potassium. Sorry, these are your sodium channel blocker. Okay. Now, procainamide is used as medicinally used as local anesthetic, anti-anginal, antiarrhythmic, or general anesthetic. Which one? Simple question. Simple question. Simple question, guys. Procainamide is medicinally used as local anesthetic, anti-anginal drug, antiarrhythmic agent, or general anesthetic. Which one? Uh, it is local anesthetic, but it is medicinally used as the anti-arrhythmic drug. Okay, so this is all about this one, anti-arrhythmic drugs, guys. And your drugs acting on CVS is finished. And out of which, 1, 2, 3, 4, 5, 6, 7, 8, 9, 9 questions. Okay. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. Achha, 10 questions. Out of 10 questions, how many questions you got right? How many questions you got right? How many questions you got right? Or you can tell me how many questions you got wrong. Sida, sida. Sida, sida, tell me how many questions you got wrong. Then I will mark. Then I will rate the rankings. Chalo, chalo. Come on, fast. Hmm. Not. That's what I talked to you. That's what I told you in the starting, even. Hana? How many questions you got right and how many questions you got wrong? That's what I'm asking. Right. So Ishwari Jadhav says 7 right, sir. Okay. Ishwar Arya says. So we have Ishwari as we have Ishwar. That's nice. That's nice. Ishwari. Okay. So now Mangesh Tikkas. One wrong. Okay. One or two wrong. Fantastic. That's nice. Very good. So we have Mangesh Tikkas. Mangesh Tikkas is the number one over here, right? And fantastic facts, you will be number two. And Ishwar Arya along with you will be your number two, second position. At number three, which one? Ishwari as well as Shravani at number three. Okay, so this is the ranking that we have for this session, right? So this is the thing, guys, and I hope your preparation is going well. And 2 more days left, 2 to 3 days. Yep. And these are the last days of GPAT 2026. And you should be privileged about the journey that you have faced, right? You should be privileged about the journey that you have faced and you have gone through, because you have not learned only the concepts, you have also learned the things, that how to being determined, how to being focused, how to being distracted from the distractions, right? So these kinds of thing. And I hope you very I wish you very all the best for the upcoming preparation, just to 2 to 3 days. And have a smile on your face, because this smile is nothing, is just like a jewelry, you can say, right? So have that jewelry on your face always. Okay, so that's all what I want to say. And keep supporting, guys. And although I'm not a Hindi channel teacher, मैं हिंदी चैनल का टीचर नहीं हूँ, but still I hope that many of the students who are here with me will be qualified and meet me over there in felicitation program of GDC, right? That will be surely takes place in April, right? So hopefully we'll meet you guys over there. And I always pray for you guys that you will be qualifying this examination, not only this examination, although every examination you will have in your life. Okay. Thank you so much for joining, and all the very best. We'll see you at 9 o'clock, because at 9 o'clock we will be doing the model paper explanation. So don't forget to join at 9 p.m. Just 1 hour from now. Okay. Thank you so much.